Hello, everyone, and welcome to NDF's 2021 Virtual Speaker Series, generously sponsored this year by the Rotary Club of Beverly Hills. I'm Nancy Lurie, NDF's Chief Operating Officer, and I'm so glad to welcome you here with us today. We're very glad to be joined today by Douglas Scott. Doug is an occupational therapist with many years of experience working primarily in the field of neurologic conditions, including neuromuscular disease. Doug moved to the University of California, Irvine in 2015, where he has spent the past few years working with Dr. Tahseen Mozaffar, who I know many of you are familiar with, NDF's clinic lead and member of our board of directors and scientific advisory committee. As a member of the NDF-sponsored multidisciplinary clinic at UC Irvine, Doug has had the opportunity to work directly with GNEM myopathy patients, giving him a unique understanding and familiarity with the disease. We're very grateful to Doug for taking time out of what we know is a very busy day to make himself available to us. And with that, I'll hand it over to you, Doug.
Hello, everyone. As Nancy mentioned, I am an occupational therapist. I'm going to be talking a little bit about both occupational and physical therapy. As I mentioned, my specialty is occupational therapy. So any questions that arise regarding physical therapy, I will be more than welcome to take to one of my colleagues and try to get an answer for you or answer them to the best of my ability. So thank you again for having me. So today, basically what I want to discuss is the similarities and some of the differences between occupational and physical therapy. We're going to talk a little bit about the assessments that each of the therapists perform and how we use them to address the individual's needs. And then also today I'm going to also be providing some samples of home exercises, but note that these are basically exercises. These are very general. And as I mentioned, I'll mention later on, please don't undertake any type of exercise program without referring to your own therapist, your own doctors, and such. So occupational and physical therapy defined. This is basically just some information. Here in the United States, occupational and physical therapists both require a postgraduate degree, either a master's or a doctorate degree. We are both disciplines are certified by the national board. Each one has to be licensed by the state in which they practice. And then also we are required for continuing education in various specialties and then also advanced certifications. I like to use this screen here. I don't expect everybody to read this. This is generally from the both American Occupational Therapy Association and the American Physical Therapy Association. This is what they describe as occupational therapy and physical therapy. As you can see, it's a pretty extensive definition. However, I have one that we have some definitions we like to use a little bit easier to understand. In physical therapy, the questions we're asking are, how are you moving? How can we help improve your movement? And then how can we help make modifications so that you're able to move safely? In occupational therapy, we have 3 questions as well. And what we like to ask are, what are you able to do? What is it that you need to be able to do? And then what would you like to do as well? So we're talking a little bit about the areas of assessment. These are very general terms of assessments that we conduct primarily throughout disciplines, but we do get more specific as we go along, depending on what the needs of the person is. So here in physical therapy, as you see, physical abilities limitations, they look at transfers, ambulations, mobility, home and community accessibility, adaptive device assessment, and home exercise programs. I'm going to go into each of these a little bit more in detail with both the physical and occupational therapies. So physical therapy assessment, like I mentioned, the physical abilities and limitations, range of motion. So how are we able to move our extremities against gravity and gravity minimized positions, those types of things. What is our lower extremity strength? What is the lower extremity flexibility and the trunk control? They are also looking at transfers. So how is a person able to do a sit to stand transfer? Or how well are they able to transfer in and out of their car, in and out of the bed, the toilet, the tub and shower? Those are areas that we are very interested in making sure that we can do those types of transfers safely. And of course, ambulation and mobility. So is a person able to walk? What difficulties they have? Is there any adaptive equipment that they're using to help them with walking? Also, wheelchair mobility. Occupational and physical therapists will assess for the specific needs of the person regarding what type of equipment is appropriate for to make sure that the person is able to be as mobile as possible. And then also bed mobility. So how does a person get in and out of the bed? Are they able to roll and position themselves? Do they need any type of assistance or care and those types of things? Home and community accessibility. Things like stair management, household ambulation. We like to make sure that we look at the environment to see if there are suggestions that we can possibly make to make sure that, again, that you're safe in your own home. If there's any recommendations that we can make, things may be such as lifts, rails for stairs or transfers, things like that, and then any other type of home modification that might be available to help make it things a little bit more accessible. And then, as I mentioned, adaptive devices. So lower extremity orthoses to kind of help with positioning, foot positioning. Ambulation devices similar such as like a cane, walkers, as such, same thing, wheelchair assessments, transfer devices, as I mentioned, if there's lifts or if there's types of modifications that may be used around the house to kind of help with the transfers, and then things like stair lifts, ramps, and handrails. So for areas of assessment in occupational therapy, as you can see, very similar. We're assessing a lot of the same thing, or very similar things such as physical abilities and limitations. One of the areas that we look at primarily are ADLs. How is a person doing their day-to-day activities, self-care activities, and then also the other area that we look at are daily functional tasks, or what we call our IADLs, meaning how are you doing with your home management tasks, work tasks, caregiving tasks. So basically anything and everything that occupies your day, we have an interest as to how we can help you maximize that participation. We also are looking at adaptive devices as well. And we can make recommendations specific to the needs of the person. Exercise program, and then also community resource exploration. So many times people don't know what questions to ask or who do I go to be able to find out some information about what resources are in the community. So as an occupational therapist, that's another area that I would be looking at to hopefully help at least direct you either with suggestions or with some resource information. So once again, occupational therapists, we're looking primarily at the abilities of the upper extremity. So range of motion, what is the strength? Again, moving against gravity in gravity minimized positions. We also are looking at the hand strength and hand function, like fine motor and dexterity, handwriting, typing, those types of things that really can be affected, and how we might be able to help with those. ADLs. So these are the basic activities that we're doing throughout the day. So you're eating, bathing, dressing, toileting. This is your self-care. So some of the questions that we will ask are, how are you doing with any one of these areas? How are you doing with eating? Are you using any type of equipment? Is there any challenges? Are there suggestions that I might be able to make to help make these activities a little bit easier and safer, of course? And then daily functional tasks, like I mentioned before, would be things like work, home management, caregiving, handwriting, leisure participation. So really, all the other things that may that your day may involve. As I mentioned, as there are challenges or limitations, we want to see if there are things that we might be able to suggest that can help with being able to participate in all those types of activities. And then one of the areas that sometimes gets overlooked is leisure participation and exploration. So what are you doing with your downtime? Are there things that you enjoy doing before that you're no longer doing? And if there's a way or that we can suggest modifying the task or the activity so that you can do those things that really are important to you. Another area, of course, is the adaptive techniques and devices that I mentioned. Are there things that we might recommend, whether it's equipment, whether it's different techniques that help to make the activities a little bit easier, help to make them where you're able to participate them in a bit easier. Things that we may suggest, what the areas that we really look at are like bathing equipment. I always tell many people I work with that, you know, believe it or not, the bathroom is probably the most unsafe room in the house because everything is hard, it's slippery, and there's always a chance for slipping, falling, and injuring ourselves. So are there things that we can use to make sure that you can bathe independently as possible, and also as safely for both you and, if needed, your caregiver. So the other things I mentioned, as I said, were adaptive utensils, handwriting tools. One area that we do look as well, resting and positioning splints. So those are things that we might suggest that you talk to your therapist about to make sure that you're getting the appropriate equipment. So as I'm working with the person, I may suggest something like, you know, here's a particular splint that I would possibly suggest, but again, talk with your therapist to see if that's what they feel would be most appropriate for your situation. And then energy conservation, making sure that, you know, our days are very busy, our lives are very busy, and making sure that we can, you know, adjust our activities throughout the day to determine if it takes me so much effort to, let's say, get dressed in the morning that in the afternoon and evening I can't spend a lot of time with my family, then maybe we need to see if there are ways that we can kind of adjust those activities, whether it's with help or, like I said, adaptive techniques and our equipment, just so that way we're able to really kind of maximize our time that we're with our families and things like that. Exercise programs. So things we do look at would be strengthening programs, range of motion, stretching and flexibility. Primarily, we're looking at range of motion, stretching and flexibility. I will many times discuss exercise programs, not necessarily for increasing strength, but to maintain what level of strength that we do have. That's a big difference as to where I might be working with someone else and be suggesting things on how to increase their strength. What we're looking at is to really make sure that we're maximizing and maintaining the level of strength and flexibility and range of motion that we currently have. And then, as I mentioned before, community resource exploration. So in Southern California, transportation is a very big, can be a very big barrier. It's unfortunately here, we don't have the same public transportation systems that they do around the world. And so that is one area that I may, if you're in the Southern California area, talk to you about the different options that come regarding transportation. And then also home safety, like we mentioned before, whether it's through checklists or things that we might need to do even normally to prepare for our home to be safe for events, whether they're catastrophic events or even just the simple recommendations as to, you know, removing running or area rugs, you know, to help make sure that like ambulation is a little bit safer, that you're safer walking through the home, things like that. So these are just different areas that we may address regarding like home safety. So a little bit about our GNE myopathy specialty clinic here at UCI. And we definitely thank the Neuromuscular Disease Foundation for their support. And here we are a multidisciplinary specialty clinic held here at UCI. So with occupational and physical therapy, initially we were doing, we were going in individually to work with patients. And what we found is that if we did it more as a collaborative model, and I'll talk a little bit more about that later, that we were able to really maximize the amount of information and that we could gather and to help make it a little bit more specific. So that's where, so we also use a hybrid model with both in-person and televideo visits. And then, as I mentioned before, the visits include meetings with your doctor, physical therapist, occupational therapist, and social worker, and then also genetic counseling as appropriate. So individual needs assessment, like I was mentioning, so we try to use a collaborative interview with our patients, or sorry, with our participants. And basically it's just to help us really, as I mentioned here in the slide, it helps create conversation versus interrogation. So there's nothing worse than having to repeat yourself 6 or 7 times in an hour's period where someone asks you how well you're doing A, B, and C activity. So this way we try to create more of a conversation, whereas both the therapists are discussing what your day-to-day looks like, what challenges you may have. If we are requesting you do certain movements, whether it's standing or walking or such, then we really get a chance to have a couple set of eyes and ears to kind of see what the person is able to do and how individually we might be able to tailor what our recommendations are. We found that it worked pretty well in the sense that I didn't have to ask the same questions that the physical therapist may have asked you 5 minutes prior. And each discipline's able to kind of pick up on things differently. We're looking through different lenses when we're assessing a person. And so we're able to pick up on different things that we could then collaborate with and come up with solutions for. And then sometimes one of the big areas that the allowing for related questions to be answered at once. There's nothing worse than you have a question and someone asks you, do you have a question, and you forget it, and then 10 minutes later you remember what it was. So this way, hopefully it kind of allows for more of a flow when we're talking, like I said, more of a conversation, and as things arise, we're able to kind of answer those specific questions as they arise. And then again, it allows us to really recognize the specific needs of the person. And like I said, looking through different lenses, we were able to, like I said, pick up on different nuances, and we were able to kind of hopefully collaborate and come up with more effective solutions for the person. So in the clinic, we will ask questions and really trying to figure out what needs can we meet. Are the ADL needs? Is there equipment that needs to be recommended? Are there excuse me? Are there techniques that need to be that we can suggest? Similar with like the IADL needs. You know, is there a particular pen that might be suggested? Is there a equipment that's out there that might make it a little bit easier for things like using a mouse or using the computer, things like that. And then, as I mentioned, you know, we're looking to assess and really figure out what needs there regarding the upper extremity. How are your arms and hands working? How we might be able to, like I said, help maximize what you're able to do. And then looking at, again, the adaptive devices, looking at community resources, and then providing a home exercise program recommendation, again, to be followed by a visit with your own therapist as well to make sure that we're on the right track. Similarly, with physical therapy, mobility needs, is there equipment, again, that may help make being able to move, walk, a bit safer, a bit easier, and like I said, what lower extremity functioning, how can we assess what areas that we need to address a little bit more, how well you're doing, if there have been any changes since the last visit, things like that. Again, like I said, adaptive device recommendations. So are there specific braces that might need to be used? Is there a different type of cane or ambulatory device that might be used? And then a wheelchair assessment. So if we require use of a wheelchair, making sure that we have appropriate things like the appropriate size chair, the appropriate positioning equipment, and things like that. And then physical therapy will also recommend exercise programs as needed as well. So the following questions were provided by some participants prior to this presentation, as you see here. So as I mentioned before, all of these examples of exercises that I'm going to talk about are purely for information and for reference. Please always consult with your doctor, your occupational, and your physical therapist before beginning or performing any type of exercise program. So question number 1 that was posed was examples of anti-gravity exercises that can be performed without assistance. So I'll be honest, I wanted to make sure that this kind of actually brought up 2 questions for me. I wasn't quite sure if the person meant anti-gravity exercises for anti-gravity muscles, or if they were talking about exercises that can be done independently where you're not necessarily moving the extremity against gravity. So I'm actually going to talk about both. So hopefully I can answer this question. So and so basically what I'm going to talk a little bit about here are isometric exercises and then extremity supported exercises. So isometric exercises, as you see, so this is basically addressing the so these are exercises that can be done anywhere. They don't require any equipment. They are very helpful with maintaining the amount of strength that you currently have. They're not used for increasing strength, but they're helping to make sure that those muscles are contracting, and they are helping to keep the muscles as strong as possible. So basically, with isometric exercises, as you can see, they're basically moving the extremity against, excuse me, against resistance. And so, as you can see, let's say the 2 illustrations here of the person in the chair, there's a bit of resistance. So what we're trying to do, so the top one here, the gentleman is actually moving his elbow to the rear, and the one to the bottom right, he's actually moving it outward to the side. And so the idea is that he's moving against a barrier that's not going to allow that arm to move throughout its entire range. And so what it does, it allows that muscle to contract, but then you don't have to worry about the weight of the arm or the weight of the extremity being able to actually lift it against gravity. So it allows you to contract to help maintain the strength of that muscle. So there is another exercise here at the top right. It's an exercise specifically for anti-gravity muscles, meaning the extensors of the back. And so this one here, where you can see this person here is actually lifting the knee from the deck, and it's actually contracting the muscles of her bottom, and then also of her low back, to help really kind of maintain that strength of those muscles, to help maintain that upright posture. And as you can see, it says here, it can be performed in multiple positions. They can be done in sitting, they can be done standing, they can be done lying on a mat. So really the benefit of these types of exercises, you don't require additional equipment or anything like that to perform these. The second is extremity supported exercises. So meaning I took anti-gravity, I wanted to make sure that I addressed both areas. And this one is specifically exercises that you can perform that don't necessarily need the help of a person, of a caregiver or another person, because you're not lifting the extremity. Again, you're not moving the extremity against gravity. So we actually call this a gravity eliminated or a gravity minimized position. So I just wanted to include that in case this is what the person who was asking the question was talking about. So as you can see in the top right slide there, or photo, the individual, the arm is rested on the mat, and they're performing a range of motion exercise similar to if you were to reach overhead. But what they're doing is they're using the mat to actually support the weight of the arm. So they're still contracting the muscles to kind of help with the movement, and they're also maintaining their range of motion and flexibility of that joint by performing this exercise here. But they don't have to, again, they're not actually having to fight against gravity to raise that arm there. The bottom one, same idea. The person is lying on their back, and they're moving their legs inward and outward. And so again, working on those hip adductors and abductors to move the leg, to work on strengthening those muscles, but again, not having to lift the extremity up in the air or off the mat or off the floor and those types of things. So as I mentioned here, these types of exercises, they do help to strengthen weak muscles. They do help to maintain flexibility and improve range of motion. And again, they can be performed in multiple positions. And again, minimal equipment is required. So basically, you find a location or support for whatever type of exercise you're doing, and then you're able to perform that exercise. So question number 2, can you provide examples how to address wheelchair use and low back pain? So again, I wanted to make sure that I really addressed this. So I wasn't sure if it was low back pain due to wheelchair use, or and so the way I broke this down is into trunk exercises, things that may be suggested to kind of help with strengthening the trunk, and then also the importance of a good wheelchair assessment. So this, again, these are just examples of exercises that can be done. Pelvic tilts, abdominal bracing, which is where you're actually contracting the muscles of the abdomen, and then trunk rotations where in this case, you're actually using gravity, you're using your muscles against gravity to kind of help limit how fast that you're at the bottom here, that your knees are actually moving to the left or to the right. So again, these are just specific exercises. There are tons and tons that are out there. And again, I would consult with your occupational or your physical therapist as to what would be the most appropriate for you. Wheelchair assessment, power chair versus scooter, appropriate cushioning, appropriate support. So it's really important that you make sure that you get the equipment that is appropriate for you, that it fits correctly. That is something that you can actually discuss with your occupational and physical therapist. The challenge with power chairs is that they're big, they're heavy, and they pose challenges such as, okay, so now how do I transport this chair? How do I who's going to help me with maintaining the chair, and am I going to be able to access all the functions? And so it's really important to get have an occupational therapist or a physical therapist assess you to make sure that not only what you're using now, but what you may need in the future. Are there switches that they have what are called micro light switches that don't require a lot of effort or force to actually engage? Might I need something like that if my hand strength becomes affected, or my hand function becomes affected? So really having your therapist really assess what your needs are. Appropriate cushioning, as we mentioned, making sure that you're in a good position, that your pelvis is in an adequate position. You have the appropriate supports for your trunk. So all of these will help with making sure that you don't have that low back pain just by like I said, just the appropriateness of that equipment. We want to make sure that you have what your needs are, what your specific needs are, and it's very easy. Sometimes people will find chairs that are for sale, and that's fine. But if you have an opportunity to have a therapist really look at that chair for you or that piece of equipment and make sure that it is what's most appropriate for you, or how they can actually help, whether it's with cushioning or supports, make that piece of equipment more appropriate for you. Question number 3, do you have a technique with helping to roll in bed? We understand that this can be a very big challenge for many people. So I'm going to talk about 3 different types of techniques here. Really two techniques, and then really one is just the exploration of equipment. The first is log rolling. So this is an example of log rolling. And basically what you're doing is you're starting on your back, you're bringing your knees up towards your chest as high as you can, and you're using the momentum of your knees in the direction that you're going to kind of help really kind of roll you as one piece, as one unit to that side. Here in this example here, it shows them push themselves all the way up to a sitting position. But you're basically using the momentum of your knees to help you with that, making that transition there. Similarly is momentum rolling. So as it mentions here, you're basically using the momentum to actually help you roll. And so I didn't have a video or anything that definitely showed this, but I'm sure that there are some that may be found on YouTube or things like areas or sites like that. But I'll just describe it a little bit. And so basically you're using momentum. So you, once again, you're using your extremities, your legs, your arms, the weight of those with gravity to kind of help roll you into the position that you want to be in. So it takes a little bit more effort with the momentum rolling, in the sense that you have to kind of position yourself a little bit better. So one would be, if we're moving, let's say we are rolling to our right, you would want to position your left leg over your right. So basically in the direction that you want to go. You're going to clasp your hands together, and you're going to use your trunk, basically rocking back and forth, to try to help create the momentum to help bring your hips over. And so, and as you rock back and forth, you rock back and forth. And then when you feel like you have the momentum, you really throw both arms to that side. So in this case, to the right, to help bring your hips up and over and to get you to that sideline position. And then, of course, there's adaptive bed mobility devices that are out there. With that momentum rolling, I would always suggest that you either have something similar to a bed rail, so we don't want you to roll completely off the bed, or you have somebody there just to make sure that you're going to be safe. But these are other ideas of bed mobility devices. Things like this wedge in the middle, you see the blue wedge. It's much easier to start the rolling if you're already in that position where you're almost in a, not quite a sideline position, but you're in a wedge position. So you don't have to fight gravity as much to get your hips over to the side. The one that's all the way on the right is it's a similar cushion. It's primarily to help keep a person from rolling completely onto their back. I'm not sure how comfortable it is to sleep. If you're not a side sleeper, that may be more irritating than anything. And with this, with the waistband, that they may not like to have a very restful sleep either. The other example on the bottom, it's a little fuzzy. I apologize for that, but it's what is called a bed ladder. And so what it does is it attaches to the end of the bed. Excuse me, and it allows you to be able to pull yourself into a seated position. And sometimes that is how you would then be able to kind of move and scoot around in the bed. Get yourself more to a seated position if your upper extremities are a little bit stronger, to where you can kind of scoot your bottom back and forth into the position that you want, and or even kind of help roll over as well. So I'm going to open up now. If there are any additional questions, please send them to the chat. I think Nancy may have a few for us, so I'd be willing to answer any questions that you may have.
Yeah, that was great, Doug. Thank you so much. I know that there were a lot of really helpful bits in there for a lot of people who are joining us, and also for the people who will end up watching this on the recording. It's very exciting to see people from so many countries joining us today. We had asked people for questions in advance, and you did a great job of covering those. We had another question, which was, my fingers have issues with picking up small items. What exercises would you suggest I do in the swimming pool that would help with finger dexterity? And then the follow-up to that, or an additional question, is there a kind of soft splint I can use to keep my fingers and hands staying in alignment?
Excellent, both excellent questions. Let me start with, so we'll start with the exercises. For finger dexterity, in the pool, the simple exercises such as, it's going to sound very simplistic, but really, working individually, focusing on, there's a couple different grasps that you make. Making a full fist is one. Making what we call a hook grasp, so where you're bringing just your fingertips down to the palm a little bit here. And then also working on just your opposition, so touching thumb and index finger towards one another. So these would be examples of some finger exercises. So I'll demonstrate once again. So making a full fist and opening, making kind of a hook where you're kind of touching your fingers just to the tip of your palm there, and then also individually touching. So a lot of times what we'll work with people is day-to-day things really have as much of an effect as a specific exercise. So working on things like buttons, working on things like typing, where you're giving those fingers a chance, the muscles in your hands and your forearm to work. It's, of course, we understand there are going to be challenges, but the best, that to me, I always say that the day-to-day stuff is as important as a specific exercise. For the there are soft splints. There are a number of soft splints that are out there. Again, I would consult with your occupational therapist. Some of them maybe some people like the resting, what's called a resting hand splint. It helps to position the hand kind of in this natural curve here with this. The one knock about those types of splints is that once you have one, you kind of take the hand function out. So I usually say that's something that you might use in the evening if you're watching a movie or during downtime. You may not want to wear that type of splint all the time. They do make smaller splints that are specific for fingers. There are different ones one's called an oval 8. That again, it kind of just goes around that specific joint to kind of help hold the finger open. Again, there's limitations as to when you splint something, you kind of take some of the function away. And so I would suggest, again, everyone's has individual needs, but consult with your occupational therapist. But those would be some ideas of splints as well.
That's helpful. Thank you. Mona, one of our patients and community members in the UK, says that picking up a glass of wine often helps with dexterity.
That's exactly. I like that.
That's an excellent suggestion, especially on a Friday. Thank you for that. So someone asked, when lying down, she doesn't have control from the waist down. So it's really impossible to raise her knees or roll. To get out of bed. So do you have some follow-up suggestions to what you had talked about?
Sure. I would say with difficulty with like the control of like the lower extremities, probably something like the ladder that was shown in the slide. And what that does is it allows you to use your upper extremities to kind of help pull you into a seated position. So it's a little bit more of a challenge because you have to pull yourself into the seated position, and then you have to use your arms to kind of help scoot your bottom into the position that you want to be in. So you can also use the momentum rolling, but like I mentioned, it takes a bit of planning, positioning one leg to the side that you want to turn, and then getting enough momentum to actually get your hips to turn over. So those would be the two that I would probably suggest mostly for somebody that doesn't have as much control with like their lower extremities.
Okay, I'm just looking. Have you got a specific technique you can recommend or something? Oh, it's sort of what you just said, something when you have to roll and lift your legs. What happens if you have nothing to attach the ladder?
It actually goes underneath there's actually a strap that goes around the entire mattress. So that is one option. There's something I was just thinking about as you mentioned. There's another piece of equipment that's called a leg lifter, and that allows you, it basically is a strap that goes around the foot and allows you again to use your arms to kind of help position your foot or your leg where you want it to go. So those would be again a couple of suggestions.
Super helpful, very practical. And I was thinking too, the lists that you gave at the beginning, for me, it was helpful also, and I'm sure for other people, the differences between OT and PT and the things that you do in your assessments are really lists that people around the world or around the country who don't have access to you can take with them to an appointment so that they can use it almost as a checklist to make sure that the practitioner they're seeing is addressing the things that you're suggesting.
Absolutely. We always say you're your best advocate. And so, like I mentioned, when we do our clinic, we want it to be more of a conversation. So that way you don't feel like the person is interrogating you, or you feel like you have, you don't want to forget a particular area or a question. So please use those lists, just, like I said, so that way you know that the person's, the therapist is addressing all those needs.
Right. And someone was just saying that she'll try the ladder, but that when sitting on the edge of the bed, like we were saying, she can't lift her legs. Mm-hmm. She gets family help for that. And the leg lifter, felt difficult. Mm-hmm. So,
Yeah, that, like I said, unfortunately, there's not going to be any perfect solution. Right. Again, these are suggestions, things that might help. And there are going to be times when you may just need a little bit of help from your family, and that's okay as well.
Right. Okay. That's great. And also I want to make sure that people, at least in the United States, people know who we can have come to the clinic for now. We really want to be able to open it up to everyone. But for now, we do have two more dates this year, October 8th and December 10th, that you can make an appointment via telehealth or in person to go down to UC Irvine and see Doug in addition to the other specialists who are there. If no, Doug, do you have anything else that you might want to add just as sort of last ideas or thoughts before we let everyone get on to their weekend?
Yes, absolutely. Like I mentioned before, as an occupational therapist, primarily what I'm looking at is to make sure that the person's engaging in the things that they enjoy as best as possible. So I encourage people to every day, find something that they enjoy doing and doing it to the best of their ability. And just know, I always tell everyone that everything is therapy and everything is therapeutic. So you don't get so caught up in is there a specific exercise or technique? Just remember, the more that you're doing every single day, you're doing, that's as important as a specific exercise that I might be able to give you.
I think that's great advice. We got one more person got in a comment with a question. I use a slide sheet under me to help me roll over from my side to my back. Is that okay to keep it there all night? It feels safe.
Again, it's what your preference is. As long as you feel safe, I can't think of a reason why it wouldn't be. As long as you're not much of a tossing and turning, if you don't do a lot of that, I think it should be fine. The only thing I could think of is maybe temperature, if it warms up, if it gets hot, but if it doesn't and you feel comfortable, then I say go for it.
Great. Sounds like that's a good rule of thumb for people to use.
Yeah.
I also want to remind everyone that some of Doug's slides reminded me, and I'm going to send it to you actually, Doug, the link to our presentation on our website that has all of the adaptive devices that we presented earlier in the speaker series. I'd love for you to take a look at it. And I want to remind everybody that it's out there for you to take a look at that has some of these ideas that Doug was sharing today. So anyway, I want to thank you, Doug, obviously, for taking the time and the energy that we know it takes to put together a presentation like this. All the comments I'm getting are from people telling me just how great it was, how informational, and how much they appreciate it. So I also, if no one else has any other comments, I want to thank everyone for joining us today and remind you that this recording, along with all of our speaker series events, live on our virtual learning library, which you can access through our website, cureGNEM.org. I definitely think this is one that you might want to refer back to and send to people you know and send to your own therapists so that they can address some of the questions that Doug was able to address today. While this concludes the summer portion of our speaker series, this is the last of our sessions for right now. We are committed to providing meaningful and important content to our community, and especially while we are still unable to meet in person, we'll continue to offer more speakers as they become available. So I just want to put out there that if there are topics you'd like us to address in the future, please reach out to us, either to me directly or to us at info@cureGNEM.org, and let us know if there are speakers you're familiar with or topics that you think would be beneficial for the community. We'd love to cover it for you. So with that, I will, Doug, thank you once again and thank everyone for joining us and look forward to seeing you here again sometime soon.